big bubble in DALK?
Thank you, Dr. Rajendra Prasad. And I am just going to be speaking on how to get a big bubble, which is the difficult thing to get in a case of DALK. This is, I always strefine and I deepen the wound with a diamond blade. I always debulk the superior epithelium. And then after that, the trick lies that take a 30 gauge bent needle beveled down, go from the periphery, keep traversing the cornea, and go at least 4 millimeter, 3 to 4 millimeter, quite a bit traverse into the cornea, have a tight and kind of a snug fit, and the needle is attached to at least 5 cc syringe. Everything has to be tight, and once I know that I've got a big hold of the cornea, go ahead and you get a nice big bubble with a thing like this. So I always like to debulk first and then go in with the 30 gauge needle, and this is just to show the complete DALK. And after I decompress the bubble, put heel on and remove the deeper stroma and then put the tissue over that. This is the another case which I am trying to show, that I've deepened the peripheral groove with a diamond knife, and after peripherally deepening it, go with the crescent, slowly remove the superficial corneal tissue, and see, again I'm trying to show, take a 30 gauge needle, traverse, and in this case, since it was far too peripheral, I didn't get a bubble in one go, and it went into the peripheral part, but I used that air channel which was formed as a channel to push my needle further. So this gave me a space. I could go in and get a bubble after that. The third video I'm going to show you is where after repeated attempts I couldn't get a proper bubble, and then what did I do? That I usually leave, so this is when I trefine. I usually do large DALKs, 8.5, 9, deepen definitely with a diamond knife, and at times I use a Heisberg Baron trefine where I have a guarded depth. So here I have tried to first attempt, I have not debulking. I am not debulking over here, and I used a pointer so that I could form a channel. Through this I have tried to put a cannula which has an opening below, but see, I am not getting a bubble over here. I have tried to show this and what to do when you don't get it. So I was just trying a different technique where I did not debulk it first, and I tried to use, this is also a popular technique. So I have done the next procedure. I have removed the superficial cornea, and after that I go with my traditional way, go with a 26 gauge needle. The trick lies here is to traverse quite a bit. It's like keep needling in. So here again I am not getting it. I don't get, and see, whenever you get air in the anterior chamber, not necessarily you have perforated. It is actually going from the peripheral trabecular meshwork. I again go in further from another place, and see, once I have not got a plane, it's a similar thing which keeps happening. But don't worry. It's like a corneal emphysema. I'm just finishing, 20 seconds more. So corneal emphysema which takes place, and then after that, remove the superficial corneal tissue, and then I get the bubble after that. So here removing this corneal tissue becomes easier because it's an emphysematous cornea. And now you see it becomes very simple for me because I am already in the depth. I go, and this emphysematous cornea helps me to put my needle very deep. And see how when I go in, it just goes, you can get a feel immediately. Yeah. So you get a bubble like that. So don't get disheartened if you don't get a bubble in a fun go. You can use these kind of techniques, and then of course do divide and conquer for the deeper stroma and finish your surgery. Thank you very much.
Thank you very much, Dr. Ritu, for the beautiful video presentation. How deep, how do you know, how deep you are going with the needle?
See, at times, I have not shown those videos, but at times I go with my Baron trefine. I would have definitely measured my peripheral corneal thickness. So I usually take 90% of that to take a Baron trefine, and through that I go. But in this kind of a case, I've seen whenever I have thinner corneas, like 300 microns, 280 microns, it's very difficult to get a bubble in those cases. Slightly thicker cornea, bubble is easier. So after that, I just get a feel. Now it's just that it's arbitrary. I
So
get
it's the resistance you feel like.
yes, I get a
We can
resistance,
take the
but I
questions.
keep going through.
We're slightly over time. Just take the question, last presentation, then we can discuss.
Okay,
Right,
thank you
right,
very
yeah.
much.
Okay. So next presentation is Dr. Harshvardhan Patil.